Living with Duchenne Muscular Dystrophy, or DMD, can be a challenging journey, not only for those affected but also for their families and caregivers. In this video, I'll provide an overview of DMD, what it is, how it affects the body, current treatment options, and what to expect for the future. Duchenne Muscular Dystrophy is a genetic disorder that primarily affects boys, though girls can occasionally be carriers. DMD is caused by a mutation in the dystrophin gene, located on the X chromosome. Since males have only one X chromosome, if they inherit the defective gene, they will develop the disease. However, females have two X chromosomes, which means they are typically protected from developing DMD, though they can still be carriers of the gene. Because women carry two X chromosomes, they often have one healthy X chromosome to compensate for the faulty one. This means they may not show symptoms, but they can pass the defective gene onto their children. Women who are carriers of the DMD gene may not have any signs of the disease themselves, but they can pass it down to their sons, who are at risk for developing DMD. It's important for women, especially if there is a family history of the disease, to undergo genetic testing to determine if they carry the defective gene. Carrier testing can provide vital information for women, especially if they're planning to start a family. If a woman is found to be a carrier, genetic counseling can help assess the risks for future pregnancies and provide guidance on reproductive choices. Now that we understand how the disease is inherited, let's take a closer look at how DMD affects the body. Muscles are the foundation of movement in the body. They are made up of fibers that contract and expand with the help of proteins like dystrophin. In DMD, there is a genetic mutation that prevents the production of dystrophin, weakening muscle fibers over time. This absence of dystrophin leads to muscle degeneration, making everyday activities like walking, standing, and even breathing more difficult as the condition progresses. DMD usually becomes noticeable in early childhood, often around the ages of 2 to 5 years old. Symptoms often start with weakness in the legs and hips, which can make activities like running, jumping, or climbing stairs more challenging. Common signs and symptoms include difficulty walking, running, or climbing stairs, frequent falls or trouble getting up from the floor, enlarged calf muscles, known as pseudohypertrophy, weakness in the arms, shoulders, and hips, delayed motor skills, such as difficulty sitting or standing up independently. While there is no cure for DMD yet, treatment options can help manage symptoms and slow the progression of the disease. With developing treatments, life expectancy is into the early 30s. Early diagnosis and intervention are key to improving quality of life. Treatment options include physical therapy, which helps to maintain strength, flexibility, and mobility for as long as possible. Steroid medications, corticosteroids, like prednisone, are commonly prescribed to help slow muscle deterioration and prolong mobility. They can also help improve strength and delay the need for a wheelchair. Surgical interventions, in some cases, surgery may be necessary to treat muscle contractures or scoliosis. Gene therapy and emerging treatments, new therapies, including gene therapies, are being tested in clinical trials. These aim to address the underlying genetic cause of DMD by restoring dystrophin production or bypassing the mutation. While these treatments are still being studied, they offer hope for the future. The outlook for individuals with DMD can vary. With advances in treatment and ongoing research, many individuals are living longer, healthier lives. However, DMD is progressive, and most individuals will require a wheelchair by their early teens, and will succumb to cardiac or respiratory issues by their early 30s. Caring for someone with DMD requires a team approach. It's important for families to work with healthcare providers, physical therapists, and support groups. Together, you can create a plan that addresses the child's needs as they grow and change. Although the challenges of DMD can be overwhelming, remember that advances in care and treatment options are improving every day. With the right support, children and families can live fulfilling lives while managing the condition. Finding support from others who understand your journey can make a huge difference. Organizations like the Muscular Dystrophy Canada and Parent Project Muscular Dystrophy offer resources, advice, and connections to others going through similar experiences. You don't have to go through this alone. With the right care, support, and a hopeful outlook, individuals living with DMD and their families can face the future with strength. I hope this video has helped you understand Duchenne muscular dystrophy, its impact, and the steps you can take today to improve tomorrow.